Hi folks, how are you? Thank you for taking time out with Twinpossible. Today I just want to talk a little bit about Accutane use before pregnancy. I was on Accutane for a few months. I took a little bit of an intermission during my trying to conceive to try to combat my skin. I didn't have any cystic acne, but I have very overactive oil glands that I tried Levulin treatments and Retin-A, the hardest strength stuff, and nothing was working. So I looked like a slob all the time with my makeup melting, and it became very problematic in my life. And every dermatologist I saw said Accutane, and everything I read about it scared the hell out of me. And rightfully so. It's probably one of the worst choices I ever made, because I listened to them eventually, and pharmacists and everybody I asked very cautiously, but yet not enough, because now I have chronic dry eye. We're talking 4 years now, so really bad. It's affected my vision, the way my eyes look, the way they feel every day. Drops, eye plugs I have in, and I can't wear contacts, nothing. So it's really been detrimental. But as far as with pregnancy, I understand the desire to clear up your skin so bad that you're willing to take horrible risks sometimes, because it's very traumatic, and I can imagine that cystic acne could only be worse. So I don't blame anyone for wanting to try it. I just happen to have had long-term effects that unfortunately we can't go back, and whatever. But as far as pregnancy is concerned, I want to clear up a few things. I knew I wanted to get pregnant because we were trying to conceive for a long time, and then we took a short break. And the break was to relieve some stress, and also I wanted to try this Accutane and see if I can get my skin under check. But that didn't really happen. Everything dried up, my lips, my eyes, but not my skin, unfortunately for me. Anyhow, but the main concern was pregnancy with Accutane. It's an X drug on the FDA chart of prescription medications. It's like the worst thing you can take if you're trying to get pregnant, like that next month, or during the month, or if you happen to already have been pregnant and were taking the drug. It is like, the birth defects on Accutane are horrific, and so they make you take a pledge to be on birth control. You have to really follow up with things. It's very strict, very hard to be approved to be on it. You have to follow a strict regime, which is very smart, because everybody, the government, FDA, everybody knows that this causes such horrible defects that they want to limit that as much as possible and force you basically to take birth control to prevent pregnancy while on it, and for up to 30 days after the fact, which is 1 month. And a lot of people think, oh my God, that's not enough time, but to set you at ease, I did a lot of research on the topic while I was, trying to conceive, before I even considered it, and then when I was on Accutane, and then afterwards I was very frightened, and so I know a lot about it. There isn't a lot of positive or good information out there, because I think anytime that someone has a war story, they'll post it, or they'll post negative information to get people upset, but nobody really shows the other side of things, which is basically why I created my blog, my story, and basically, said if I could achieve this, then I'm going to spread the good word, so people could see the positive side of things, not just the negative. And so I'm doing the same thing with the Accutane. And I wrote a blog post, and I get tons of feedback on that, and thanks from people who want to have a family but are desperately afraid because they are taking Accutane and in the future want a family, or they're coming off it or have been off it and want to know if it's safe. And yeah, my twins are perfect and healthy, and I got pregnant on the 4th month post-Accutane. We started trying 3 months. I gave myself that buffer, but I do believe that what Accutane says, all of the names included underneath, Saray, Rockatane, all those generic names for Accutane, they're all in the same category, and they all can cause the same defects, and they all say to wait up to a month after stopping the drug before attempting to get pregnant or getting pregnant. So if you get pregnant on day 31, you don't have to freak out. You're not anything. If anybody posts anything different than that, then if their child had a cleft lip or something, it's just because birth defects actually they happen to the normal population. If they linked any type of birth defect to before a month after just using the product, their butts would be sued so royally, and they already have enough lawsuits for other medical complications that they wouldn't dare take the risk of unborn children and their precious lives and also their money and their business. So while they're out in the open about everything, lawsuit-wise against them, for physical problems that people have gotten from it, as far as the pregnancy aspect, there are no lawsuits there because there are no, as long as you follow their directions, there are no birth defects. And somebody said, oh, it can cause infertility problems. That's also a myth. There are no fertility issues that come from taking Accutane. That is completely and totally false. And if it makes you feel any better, it's not just the fact that I did so much research and that I actually have twins, that the third, almost fourth month off is when I got pregnant, and they're fine and healthy and wonderful and beautiful, as you can see. But because my father was one of the head investigators for the FDA for almost 40 years, so he knows everything about drugs, and believe me, he says they cannot say that if they are not certain. It's probably less time, and they're covering their tracks and their butts by saying 30 days, but likely the drug, they say, is out of your system within days. So really, they're just like covering their heinies and giving you an extended period of time. So that 1 month time is actually longer than, just to be safe. But I felt comfortable with the 3-month mark, so at the 3rd month we started going for the IUIs, and on the 4th month we were successful. So, and nothing ill came of it, and it didn't affect anything, and my fertility was already a problem, so, but it is shown that that is absolute falsehood. 1 in 6 people have infertility problems, so if somebody happened to be using Accutane, they could be one of the 6. That has nothing to do with that drug. So if you're fearful of that, don't be. And if you're fearful for your child's health, don't be. But if you are pregnant on Accutane, or if you get pregnant like within a week or 2 after, talk to your doctor if it's a week or 2 after and see what they say, because it does get out of your system within that 1st week, and you probably will be okay. But I know that, even still you're scared. But if you take it and you get pregnant on it, that's a terrible situation, and I can't offer you any hope in that department. The chance of something bad happening is quite extreme. So termination, honestly, as pro-life as I am, if birth control failed and I ended up pregnant, I would have to have terminated, because I can't even imagine that it would be a life probably worse than death. And, it's not a guarantee, but then again, you're taking a huge risk. And I already lost a son, and it's something I could never ever do again. And I couldn't live with myself knowing that I caused my child any harm. So that also was a reason I really, really looked into the subject. And you can feel safe that if you wait that month, you're good to go. And if you feel like me, more comfortable waiting a couple, 2-3 months, then go ahead and do that. But don't listen to these stories that say you got to wait a year, or you got to wait 2 years, or you can never have children, because that crazy information is out there to scare you, and that is so false. And any doctor that says that to you is totally undereducated. Get yourself a new one, because they know nothing. No doctor would honestly say that, and people do like to scare people, and I don't know why that is, but they do. So let this be a positive story for you to hear, and some positive input for you when you're making your childbearing future decisions, or if you're trying to conceive now and you are off Accutane. Okay, so hopefully you get a better result than I did, and you're happy with your results, and you go on to have a happy life, and no bad repercussions from it. But when coming to childbirth and your fertility and your pregnancies and your outcome of your pregnancies and your child-to-be, you could feel safe after that 30-day mark. And if you don't believe me, believe my father. Okay? And so that's it. So thank you for taking time out with me at Twinpossible. Anything's possible if you put your mind, your body, and soul into it. Take care.